once you have that little space, then what you can do, for example, we're going to be doing a little bit here because this is a little bit, needs a bit more rotation here, and this one needs to come out slightly more, so there's a little bit of lack of space. So we're going to do a little bit of IPR here. So what I would do is that I will take this and then I'll just kind of slightly open up the space a little bit here, just tiny bit, so we can actually go in with our the disc itself. So when we work with the disc, what we want to do is that, like for example, I'm looking at which surface is actually a little straighter, because if you go to the bit more rotated surfaces, you may be losing too much to structure here. So I want to look at it in terms of which surface is actually a little straighter. So we're going to go for that first a little bit to have a little bit of space here, right there. That's what I did earlier, but I'm just going to kind of demonstrate to you here, right there, okay? And then what we do is we switch this over to the other side. Because if you look at this, this is what it looks like. So I'm going to switch over to the other side. So what happens is that now we're going to switch and work on the other side a little bit, because again, this tooth is slightly more rotated, this thing, more lingually inclined. So I want to bring it out a little bit. So I'm going to do this a little bit. Just be careful with the lip and the cheek, because I really put my hand over it to support it so that nothing pops up. And I'm going to ask the patient not to close at all. Just a little bit here, yeah, just enough for us to sort of get in there and give it a little bit of room here. Now this is a case that we're going to be sending off back for refinement. So I'm actually doing this ahead of them, because then they're going to send it back and we need to create a lot of room, because you have to decide that you need the room. The Invisalign shouldn't dictate to you that, you know, you need to have the room there. You actually have to decide that what are you going to be doing next. So with the same one that I had the disc where the diamond side is, I would now go to this side here a little bit and do a little bit of a this thing, shaving slightly there, because remember, this is a little hard to do. So I'll do a little bit, but not too much, okay? And then I would go with the disc itself, which is a soft flex disc, because it's fairly flexible. So we're going to use a soft flex disc here, so you can see this here. So now I can go in and actually smooth it down, round it off a little bit, like that. Now, usually when you have Invisalign tell you how much to do, they'll tell you 0.2, 0.3, whatever it may be, right? So for that instance, you can use the thing to sort of look at the shaving that you have done or the IPR you have done. So we're going to just do a little bit here. So you can see that we have created, come on, can you bring this a little bit here? So you can see that we have created a little bit of room here so that this tooth can actually rotate a little bit better into this position here. Otherwise we'll be fighting and they're going to send it back to us anyway. So that's how I would probably do it right now. And if you really wanted to check it, come on, do you have the thing? To check the IPR? Yeah. Yeah. So I'm going to hold it. Kumar is going to bring the IPR. This thing to check it, and then you can just have a look at it, see how much you have actually done. We're probably looking at maybe 0.1, 0.2, not a hell of a lot here. So we're going probably like, you know, 0.1 millimeter here. See, that's what I said we have there, more or less. Maybe even 0.2, but it won't be more than that. So let me go to 0.2. Yeah, we're getting a little tight here, you can see. So about 0.2 would be what I've done here. That's just to give us a head start. So when the Invisalign trays come back for refinement, we already have it done, so we don't have to redo that. And also they can plan it so that hopefully it'll be better, right? This is 0.25, right? Yeah. So you can see it's a little tight here. This one is just about right. So, you know, 0.2 to 0.25 of a millimeter right there. Cool. Thank you. Come on.